We're live, Kevin.
All right, great. Well, thank y'all, everyone, for joining us. I'd like to call to order the meeting of the Health and Wellness Advisory Committee for this beautiful March 1st, 2023 day. I want to thank you for taking your time to be with us this morning and know that all of you are very busy, and we thank you for all that you do in our community to make the city of Charleston and our residents healthier and better informed. So thank you very much for all that you do. Do want to mention that Lisa Burbage, Nick Osborne, oh shoot, there was one other said they couldn't be here.
Lisa Burbage.
Okay, Lisa, Nick,
and Kimbo.
Okay, Kimbo, yeah, that's right. They all sent their apologies for not being able to make it, but they had other commitments this morning, and they did wish they could be here. So yeah, great day today. I walk my dog every morning before work, and it was a perfect morning this morning. Nice temperature, and the sun was coming up a little earlier, so I got to see a beautiful sunrise instead of the darkness that I've seen the last couple of months. And of course, that brings up that daylight savings time is going to start next weekend. So just a reminder for that. So we'll spring forward. We're going to have some more daylight in the afternoon and early evenings beginning the week from Sunday. So I know I'll look forward to that and enjoy that. Should be an exciting and busy month for the start of spring in the city of Charleston. We're starting to see more boats in the rivers and harbors. Azaleas and flowers are starting to bloom. We're seeing grass and trees turn green again, and it's great to see our spring sports with the City of Charleston Recreation Department start back up this week. I was walking through West Ashland Park Monday night, and it was great to see just so many kids out there playing soccer, baseball, and softball. And I was told that we had about 1,000 children out there at West Ashland Park this week, and of course, throughout all the parks for the city of Charleston, we have about 4,500 children participating across all our parks. So exciting time for our parks and our recreation department. And of course, the Charleston Food and Wine Festival kicks off tonight and runs throughout the weekend. And Paul, we've got exactly 1 month from today, we'll have the Cooper River Bridge run. So I know you're getting busy and gearing up as well. So anyway, exciting times. And again, I appreciate all that you guys do, and I hope that you'll enjoy these exciting warmer months, hopefully spring months in the city of Charleston. So on our agenda, we have the approval for minutes for February 1st. Paul has an update for those minutes before we approve them, Paul.
Yeah, I don't know if you can, let me get the screen up. If you look at the minutes on the screen, Katie Richardson had, during her talk on page 6, had talked about several people that were game changers for the for our, do y'all see the minutes? You see the minutes? Yes. So I just went back in and put the names in of the people that she had identified. I had left them out. And at the end, I also included Dr. Powers' presentation from Federal Healthcare. And I will send those updates to you, but those are the changes I needed to make on the minutes.
All right. And I'd like to make a motion that we approve the minutes as amended. Can I get a second on that?
I'll second.
All in favor of approving those minutes, please say aye.
Aye. Aye.
Any opposed? Okay, the minutes have been approved. So we'll move to our community updates. We'll just kind of do a round table discussion on here. I want to call on Tracy McKee from the city first, if she would, please.
Sure. Thank you, Councilmember Shealy. So this Saturday is actually Open Data Day. And what Open Data Day is, it's an annual celebration of open data for all over the world. So to celebrate Open Data Day, Charleston will have its own Open Data Day program this Friday, March 3rd, from 9 to 3:45. The program is open to everyone. Attendees will learn about the city's open data program and how staff and residents are using open data to improve services and quality of life for all of our residents. There's information on the city calendar on our website about how to register for the webinar, but I'll also put the registration link in the chat for all of our Zoom participants. and happy to try to answer any questions folks might have.
Thank you, Tracy. Any questions on open data or any comments or questions for Tracy? Okay, great. Guess I'll call on Maggie Dangerfield from Charleston County Schools next, please, Maggie.
Hi, thank you, Councilman Shealy. I hope everyone's doing well. We are well underway into second semester. We have spring break approaching in a couple of weeks, starting April 10th. In the interim, though, we have just updated our schedule for voluntary COVID-19 and flu test clinics in March. Those begin today, actually. And they're again across the county at several different school locations, generally starting either at 10 a.m. or noon, going through 6 or 7 o'clock at night, with weekend testing available at West Ashley Center for Advanced Studies on Saturdays and Burke High School downtown on Sundays. So I'll be sure to drop that in the link as well. Additionally, we have kept up with our COVID-19 dashboard this year. That is available on our website, tracking reported cases at our schools and central offices. And we have been seeing a trend downward of reported cases. So that information is available as well. Other than that, our academic calendar options for public input were released this morning for the 2023-2024 school year. We have two options, option A and B, and there is a comparison document as well that kind of identifies some of the differences. But generally speaking, school would start Wednesday, August 23rd, and that is because in the state of South Carolina, there is a law that prohibits public schools from starting before the third Monday in August. There are some schools across the state that have applied for a modified year-round calendar and received exemptions to where they can change some of those things, whether they're staying in school all year and having bigger chunks of breaks, or they're just adjusting their start and end times. But those options are available on our website, and there is a difference in the spring breaks between the two options, with tentative alignment with the neighboring counties, depending on which option is there. So we encourage all of our stakeholders to come on the website between today, the 1st, through March 14th and provide feedback and input. And then ultimately all of that input will go to our Board of Trustees for their regular meeting on March 27th, where they tentatively will approve a final option. So those are kind of the key highlights going on in the district right now.
Thank you, Maggie. Any questions for Maggie? All right, and Susan Johnson, I see you on here. I know you don't have your video on, but just looking to see if you have any updates that you want to share.
Yes, thank you. And I will put my video on just for 1 second, just to say that I'm also enjoying the beautiful weather and trying to get my exercise in before a day full of meetings, including this one. Yes, I did send, I think, to the group, hopefully y'all received the invitations for our South Carolina Healthy Business Challenge spring seminars. The one that's in the Low Country is March 15th at the Harbor Club. So we encourage everyone to come out. As a reminder, it is free through our generous sponsors, Blue Cross Blue Shield of South Carolina and Gallagher. Also, I want to make mention that we will be completing our statewide expansion of that program in May. We'll be launching the Midlands on May 17th in Columbia. So if you have colleagues or businesses there, please mark that on your calendar, and we'll continue to share that information. One of the programs that we support is Adventure Out. So we have monthly free yoga in the park. This program was started at MUSC, and the Healthy Business Challenge continues to fund it. So our Wellness Center yoga instructor, Gail Corbett, will be in the gazebo at Hampton Park on March 11th at 9 o'clock. And again, that's free for all community members to come out and enjoy. And then just kind of a heads up, I know I talked about this last year, but MUSC has been involved in sponsoring a statewide campaign to get folks in the outdoors. And the campaign is called the SE7. And in July, we hike paddle, bike, walk from the mountains to the sea, kicking off on July 1st in Oconee County, and then working our way through Charleston. We'll finish up in Beaufort this year. But we are finalizing the daily activities, and in particular for this group, we help put on a series of events in Charleston called the Adventure Out Weekend. So as the expedition team gets into the Low Country, we look for partners that would like to host events that encourage being outdoors, green exercise, green health, sustainability, community engagement, all the things that we as a committee are committed to doing. So I would just encourage you, if you have some ideas, to please reach out to me, because we're kind of trying to finalize that so we can start the promotions in April. And that's it.
All right, very good. And Susan, who's eligible to be a part of that SE7 hike, paddle, and all of that?
Well, we have a small core expedition team, but many of the days are open to the public. So in April, we'll publish the field guide for the entire month. And so folks can, go through it and see which ones are open, kind of follow us along. And then we also have a virtual fitness challenge that is going on right now. So if anyone comes to our healthy business seminars, they will get a free access to that tool as well. So there are a lot of ways to engage, and I'll continue to update this group.
Okay, great. Well, thank you very much for that information. Any questions there? Joey Current, Trident United Way updates.
Hey, thanks so much, Councilman. The only update I have for folks is we recently hosted a panel with several of our area mayors where we talked about one of the tools that we have at Trident United Way. It's a 211 helpline that is available 24/7 for anybody who is in need of any services. So I just want to put in a little plug to remind folks that resource is available to anybody. We get a lot of data on the back end about the different calls that folks are making who are in need of assistance from one thing to another. And so we use that data to put together reports on a pretty regular basis. If that is something that this group would like, we can package that and put it together so that folks on this call can see what the major calls that folks are getting in their specific region. So just wanted to put that plug in. That data is available, and I'm happy to make the connection to get that out to folks. But we had a great presentation, and it really does help us and everyone determine kind of what the biggest needs are that folks are calling for assistance.
Great, thank you, Joey. Any questions there? Very good. Carolyn, I know you're off screen. I didn't know if you had anything that you wanted to bring to the group. Okay, I'm going to call on Paul Wieters.
Good morning.
Oh,
no,
I'm sorry, Carolyn.
just a
Sorry.
good morning. Sorry about that. It took me a second to come off mute, but no, good morning to everyone. Always glad to be on the call, and I hope everyone has my phone number or email available. Always exciting to hear about the initiatives happening in our community. Tap me on the shoulder at any time, something that you think that we should be doing and showing to viewers and readers and listeners on air. Always happy to get those stories done. So thank you for this opportunity. I appreciate it.
Great. Thank you so much, Carolyn. Appreciate what you do. Thank you. Paul?
Hey, I just wanted to show a couple things, remind people of these tools that are out there in the city, although I've just lost one of them. But I wanted to remind everybody, first of all, the mayor puts out press releases every so often, and I want to remind everybody about the ones that we have currently out there. Is that our sustainability has got the hosting of composting workshops, and the next 3 coming up, so March the 4th, March the 20th, and March the 19th, April 19th, are chances for the workshop, for the residents to learn about how to do composting and pick up a reusable kitchen compost cat thing. Those once those are in place, then people can start learning where to drop them off and participate in them. But those are open. I'll send those emails back out to you that the mayor put in his press releases. And then starting this March the 8th and or March the 4th, the 11th, 18th, and 25th, there'll be a limited farmers market at Marion Square. And then the real farmers market, full-fledged, will start right after the bridge run on March the 8th and continue through November the 25th. And the West Ashley one will start April the 19th at Ackerman Park. So I just want to make sure you had that information and knowing those kind of things are coming up. There's also something coming up from our neighborhood group, the division, that is going to be doing a community cleanup. They do this every quarter, I believe, but this next one's going to be in the Ardmore area, and they're going to meet at the Pink House right on Mulberry Street and do a neighborhood cleanup where a lot of city employees will be engaged. They're asking neighborhoods and neighbors and friends who would like to come out and join them. That would be a big citywide cleanup going on. And the last thing is I wanted to remind everybody that the city has a newsletter that's called Hey Charleston. It comes out each Friday, and I'll send you this link here. I had the newsletter pulled up and I accidentally knocked it off the screen a minute ago, but that's the sort of, if you want to know what's going on in Charleston, or you want to pass your programs on to what's available in Charleston, you'll see this newsletter that comes out each Friday. It's just one of the most valuable resource tools I think the city has to offer right now for getting information out. So I'll send you that link and just encourage you to, if you haven't signed up, to sign up for it, because I think it's well worth the opportunity. And again, April 1st, as Kevin had said, is our bridge run. The expo is on Thursday and Friday over at the Charleston Area Convention Center in North Charleston, and then we're expecting somewhere between that 28 to 30,000 this year. We're still building our numbers back after COVID, and hope to slowly get back to where we were and exceed them in the future. So look for a big event, and let's hope for good weather and nobody gets overheated too much. So I'm looking forward to seeing everybody in any of those events. Just encourage you to just be mindful. There's a lot out there that's for us to do in Charleston, and it's, as Susan's doing her walk today, that's a great chance. Yeah, I was at an event on the February 11th that I met the group that's doing the walk in the park with a doc, or doc walk in the park. And they do that every Saturday morning. I think it's from 9 to 10, but they pair a doc up with the people walking, and they just have a conversation. It's free to everybody. And that's another one that we'll put out there. Just make sure everybody's aware of what's going on with it. But it's just, those are the kind of opportunities we want to see in our community, where we just find the time to relax, but even talk and try to see what we can do to help each other. So I think that's all that I had on mine.
Great. Thank you, Paul. Appreciate that. Any questions for Paul? If you don't receive that Hey Charleston email, I will tell you that I enjoy seeing it, looking through it. It's a good email. If you don't get it, I would also recommend that you subscribe to it, so you can see kind of some of the things that's going on in and around the city of Charleston. So, anyway, I do see that Meredith Berlinski joined us from Roper. Meredith, not to put you on the spot, but if you have anything for a community update, we'd be glad to hear from you.
Hi, good morning. Sorry about that. I'm having a little technical issues. I'm up at the Berkeley campus today. No, as of this second, no, it's not really on the spot either. I appreciate that. I don't have anything with me right this second.
Okay. All right. Thank you, Meredith. Appreciate that. All right. Well, I do see some things in the chat, so just wanted to bring your attention to that. Some different things from Tracy and Maggie and Paul. So just want to bring your attention so you can see those. those links and information there. So, we're going to hear from Katie Richardson a little bit later. I don't know if you had anything outside of that, all right. And if not, do want to congratulate Jennifer Roberts. She is now Jennifer Brush. She has gotten married and changed her name. So congratulations to Jennifer. And I'm going to call on her now for our mental health update, if you would, please.
Well, thank you very much. Good morning, everyone. Paul asked me to try to find some data on adolescents and kids, and in that I've got a whole lot of other data. So it's really interesting information, but it's going to be hard to be interesting to show you a million slides, but I'm going to do it. It's suicide data that we do here in our Office of Suicide Prevention, and we team up with some researchers in the South Carolina Communities of Care. And I have a lot of updated information. It's going to be an overwhelming amount, but I did send these two PowerPoints to Paul to share with you all so that you can look at it later. It's not flowery and happy as your intro, Councilman Shealy, because we're talking about suicide. But yeah, so if anybody has questions, the people to contact about more information about all this information is on these slides as well. But I do have one other update, which is exciting. So I've been talking about our Crisis Stabilization Center being in the new Social Services Hub, and we were waiting. It took us a little bit to get it relicensed as a Crisis Stabilization Unit. That did happen. We had a few staffing issues, so we couldn't open right after that happened. But as of today, we are reopened, and it is a 10-bed voluntary facility for adults who are having a mental health crisis. You can stay there up to 14 days. The average person stays 2 to 3 days. And we take a lot of people from the emergency departments. It is a jail diversion program also, and a hospital diversion program. So we'll probably be putting out a press release as soon as we open in a few more days, making sure we have enough staff to be there. But it's very exciting. It's a beautiful unit. And that's really good news for us. So we finally got it back open. So I'm going to try to share the screen here. Let me see. All right, can y'all see that? Okay. So as I said, this is a combination of research from several folks. I'm going to kind of slide through it as fast as I can to try to stay in my 20 minutes. So some overarching key points that came out of this research is that Charleston County ranked second in South Carolina for EMS self-harm calls in quarter 2022. The county follows the statewide trends on age, ethnicity, and gender, and I'm going to be showing you some of that information. It does tend to skew to more Black or African-American folks that are calling for EMS self-harm calls. And I've got a lot of information that I'll just kind of show y'all. About 63% of people living in Charleston report adverse childhood experiences. And that includes emotional abuse, sexual abuse, parental divorce, separation, and substance use. So here's some information from kind of 21 to 22, and you can see that the US average is the orange line and South Carolina is the blue line. And when you're seeing percentages here and rates, they're usually basing it on 10,000 people as we're looking at these charts. And I'm not going to spend too much time on a lot of them because there's a lot of information here. This chart here, just to kind of give you an overview, is comparing Charleston with South Carolina rates. So as you can see, like, for example, in the mental health section of it, it's showing that South Carolina has 78% and 82% for Charleston for depressive disorder. This is a lot of information, and I've got a lot more to show you. So I'm just going to go to the next slide. If you want to look at this more closely later, you certainly can. And these are interesting charts. It looks a lot like when we're looking at food deserts and we're looking at other areas of Charleston that do struggle. And so they did some social vulnerability looks at the Charleston area. And you can see the highest is in the darker colors of blue. But they looked at 4 different things. This is overall social vulnerability. This is a person's ability to prepare and respond to a hazardous event. So it could be a natural disaster, tornado, hurricanes, things like that. These next 4 are looking at socioeconomic status, disability, race, ethnicity, and language, and housing and transportation. And it's a lot of information. You could probably spend 3 hours talking about these charts. But as we usually see themes, I know this group looks at a lot of these type of charts. I know, Joey, you guys put together a lot looking at Charleston, and they tend to often have themes of our areas that are most vulnerable. So they looked at EMS calls. So that what they're doing is looking at, they get data from all of the emergency rooms and try to put it all together for us as a state. Most of the not self-harm calls are coming from the Black and African-American community, as you can see. The white community, I'm reading that backwards. And the Black community is the second highest. Mostly, they made some comments in the data about how they need to break up ethnicity better, obviously, because if you say not Hispanic or Hispanic, that's not really a good way to look at this information, but they are working on trying to get more details. It's basically a 50-50 split on self-harm calls to EMS. This one does kind of show you that 15 to 24-year-olds have a much higher rate of calling for self-harm in our area. The next highest is 35 to 44-year-olds. And it is even surprising that the number of younger kids, 14 and younger here. All right, so I'm going to jump to another set of slides here. So hold on one second. All right, so you guys can see this one too? Okay. Same group looking at information here. It's 2022 data. It's the most recent that we have out. We're going to look at several different things. And this one's very long. I'm going to try to go fast through it. There's 52 slides, but again, I hope if you're interested in looking at it in more depth, you can do it later. I do want to say, so they're looking at billing codes in emergency rooms to try to figure out some of this information. Suicidal ideation, if you're unfamiliar with that means, it means people who are having thoughts of suicide. Attempts are obviously when they attempt some kind of behavior to die by suicide. And when we talk about mental health traumas, these are physical, sexual abuse, people with PTSD, or a history of self-harm, to help you understand some of the charts. All right, I'm going to skip over this part. Okay, so this is when looking at rates, you're looking at out of 10,000 people. And you can see we had a dip in 2018 for South Carolina suicide death rates. But it has been consistent after that in 2019 and 20. So in 2020, this is the most recent data they have right now out, and there was 867 suicide deaths in South Carolina. I'm sorry, yeah, okay. I was like, wait a minute. So for the 3 years, there was over 3,000. And suicide deaths have increased a little bit by 3.5%. Kind of a scary statistic is approximately every 10 hours, someone in South Carolina dies by suicide. So some of the kind of overview of the data shows that 25 to 64-year-olds are roughly tied for the highest number of suicide deaths. 25 to 34 and 45 to 54-year-olds are tied for having the largest raw numbers in each category. And again, I'll show you some of these charts in a little bit. I'm not going to read the rest of them all, but Greenville, Spartanburg, and Charleston do have the highest raw numbers of suicide deaths. More males have died from suicide and in the raw numbers that you'll see. And white people have the highest rates and raw numbers in the information. So as you can see here, from 2017 to 21, unfortunately, our ideation rates are going up. That's from people that are thinking about hurting themselves. So in 2021, over 20,000 ED visits with suicidal ideation. And that's like one of the good reasons, like, for example, our crisis stabilization unit, for people that have suicidal ideation, but don't have a plan, they don't have, they're not eligible to be committed to the hospital. They can go to places like CSUs. And I know that we're trying to get several more open throughout the state and open throughout the country. It's part of the whole 988 crisis continuum of care for folks, because, you know, our numbers are high, and so is the rest of the country right now for suicidal ideation. When you look at 2017 to 21, unfortunately, we had a 23% increase. And they say every 25 minutes, a South Carolinian has a suicidal ideation thoughts, or 57 people a day, which is a lot. Okay, so the younger age group of 15 to 24 make up about 20% of all people treated in the emergency departments. Again, this is kind of a repeat that Charleston, Greenville, and Richland have the highest rate of ideation numbers. And then Charleston, Greenwood, and Dorchester have the highest rates of ideation that's treated in the emergency departments. More males were treated than females, and there's a steady increase going on over the past 5 years that they've found from looking at the data. And whites have the highest raw numbers. So I'm going to move on to the next slide, because you're going to see some of this data here. Attempt rates kind of went down until COVID happened, and obviously we talked about this on this call, and several folks here have kind of shared information about that. We know it's been kind of on the rise since COVID in 2020. All right, I'm gonna skip this one and go through some more charts for you. Okay, so the mental health trauma rate is going up a little bit, but it's pretty much the same as it has been since 2017. Again, almost 30,000 visits to the EDs for this. The mental health trauma rates have increased almost 30% in the past 3 or 4 years. So that's going up too. And then every 19 minutes, somebody is treated for the traumas of sexual abuse or alcohol and drug treatment or other things that were listed kind of earlier in the slideshow. All right, I'm gonna skip this just because of time. So, all right, so suicide deaths, let's show some more charts. So we have 16 per 10,000 in 2020. If I know when the next bit of data comes out here, you're probably going to see a rise on this chart as it goes over time. So males clearly die by suicide more than females, 80% versus 20. And that actually surprised me when I saw that. I know we do treat a lot of males here, but it doesn't seem like it's a 80-20 difference on people that are that do die by suicide. All right, you can see whites definitely exceed blacks or other ethnicities, with 86% dying by suicide. So here's some numbers that'll kind of make you go cross-eyed with all the colors, but you can look at 2020, and most of these categories of age groups, the numbers have risen. That's the yellow line, the most recent. And as you can see, the 15 to 21-year-olds, it's a huge jump from 2019. Most areas, there was an increase, not all of them, but definitely that younger age group has had a significant increase. And this was suicide deaths. Looking at it, the highest in this area was 45 to 54-year-olds. All right, so this is a giant chart of lots of our counties. As you can see, Charleston, this is raw numbers now, we were number 3 in the state from 17 to 20 for suicide deaths, which is nothing that you want to be bragging about. And you can see Berkeley's down here at number 10, Dorchester's at number 11 as far as raw numbers go. Okay, so this is the rate. Where do we go here? We're actually pretty far down. Here we are, number 29. So when you're looking at rates compared to raw numbers, I guess it's good that we're not at the top of the chart. But this is something that you can definitely, look at later. Berkeley's right near us too. Where is Dorchester? I don't see Oh yeah, here we go. Dorchester's at 19. It's higher than Charleston and Berkeley. All right, so here's some ideation. As you can see, unfortunately, over time, the ideation rate is going up, and it's going to continue to go up. When you look at charts after those time frames, now here's males and females are a little closer with ideation than actual suicides. Again, the white population tends to be higher than any other ethnicities, and you can see, interesting here, the ideation rate on this chart on the side, the gray bar is other, and so that's definitely took a huge rise in 19 and dropped in 2020. The other two are kind of more consistent and closer together. All right, now this one is definitely one that kind of screams out to that younger 15 to 24-year-old group. You can see the numbers are definitely much higher than the other groups, and for the most part, 2021, you can see the ideation rates rising in almost all these categories. In this area, so this obviously was clear by looking at the chart for this one, that 15 to 24-year-olds have the highest rate of suicidal ideation. And this is the raw numbers here for suicidal ideation seen in the emergency departments. Charleston, number 1, with 14,000. Dorchester's down at 5,000, and Berkeley almost 6,000. And here's the rates again. Charleston being number 1 here for suicidal ideation. Dorchester's at 3, and Berkeley's down at number 10. All right, so here's suicide attempts. They did go down a little bit, but as you can see, they're rising up after 2020. And like I said, we'll probably see when more data comes out, there's going to continue to be a rise here. So attempts, females do attempt suicide more than males, but as we saw from some charts earlier, males are actually do complete the task, unfortunately, because that's a big difference. And this kind of explains why we see a lot of females in treatment here and probably MUSC and everywhere else. I don't know that if it's females get more treatment, it maybe actually do more self-help things to not be completing suicide, but that would be a good thing to look into. Attempts, again, 73% of suicide attempts are from white people, and only about 20 are from Black or African-American people. Here's another kind of stunning chart here, 15 to 21-year-old, 24-year-olds, excuse me, much higher suicide attempt rates than any other group of people. And that's been consistent for several years. And this is just kind of a summary of that chart showing that they are the highest at 33%. Okay, so we got attempts by raw numbers again. Charleston's number 3 on attempts on raw numbers. Berkeley's down here at number 7, and Dorchester's at number 9. So we're, unfortunately, our area is usually at the top of these charts, no matter how you're kind of looking at it. These are the rates. Dorchester is higher than Charleston and at number 6. Berkeley's number 10, and Charleston's over here at 23 as far as suicide attempt rates. This is easy to see that poisoning and toxic effects are the number one reason or number one suicide attempt method. Usually it's drugs and alcohol here. Firearms and explosives are, I was kind of surprised seeing how low that was for attempts for firearms, because you do hear a lot about people using guns to do this. Okay, so trauma, we go through these. So this is saying, remember, we're looking at these rates, it's out of 10,000 people. Looks like that the numbers are rising just a little bit here. Females are reporting more trauma than males across, and the numbers do consistently keep going up for this area also. 68% white and 27% black and 5% other. And again, that other category, you see that big dip in 2020 and then it starts going up. But that's interesting to me that that population has that big dip that year when you look at any of these numbers. So for trauma, mental health trauma reports, you can see almost every category, 2021 is higher than any other year in the past several years. 75 plus it jumped a lot. And of course, 15 to 24-year-olds again, reporting more mental health trauma in the emergency rooms. All right, let's see. So raw numbers again, mental health trauma, Charleston's number 1, Berkeley's number 7, and Dorchester's number 9 out of all of our 46 counties. For the rates for the trauma, Charleston's at the top again and number 2, Dorchester's number 8, and Berkeley's number 11. All right. Let me stop sharing the screen. So I know that was a lot of information, and it's hard to present that and make it sound exciting or good, but it's I thought that all of it was important to share with this group, and so you can take a look at it. I know all the EDs are busier and busier with mental health patients. The jails are busier with mental health patients. It's just, as when Paul kind of asked me to talk about this, it's because there's been articles in the paper on increases with kids. I know Maggie and everybody sees it in the schools. We did actually serve 103 schools in 2022, providing mental health services. We're starting to get some of our school mental health staff back, and continue to get busier with our mobile crisis team here. We're the busiest mobile crisis team in the state here in Charleston, Dorchester. It's not necessarily because the rest of the state, like Greenville and Columbia, don't have as many calls. I think part of it's our relationships here, and we've been doing it for so long. So fortunately, people are reaching out to us. That being said, I want to give you a little update on 988. We actually have hired some of our first people to work the 988 call center. We're going to hopefully be training soon with Mental Health America in Greenville to be able to work under their platform until we get our building across the street, so that we can help support South Carolina and answer all the calls here in South Carolina for people that are calling. Those numbers are going up too. I can probably just get some information to share with you about 988 as well, as far as our state goes. But I know that there's a lot happening in the crisis care continuum, funding coming from the federal government to try to make all states have more options for treatment and for places for people to go and get help that aren't necessarily emergency departments. So we've been very busy planning all this. So just wish us luck on finding enough staff to do it. And if you know anyone looking for a job and wants to work a call center, we do have the mobile crisis call center here and the 988 call center. It's a great place to learn. So if you know anyone who wants to work part-time, full-time, or anything, send them my way.
Great. Thank you, Jennifer. A lot of information. Thank you for sharing all of that. And thank you for all that you and your team do. We appreciate everything. Any questions for Jennifer? Katie?
Hey, Jennifer, I had a quick question. I threw it in the chat, but you mentioned two different, no, it's okay. You talked about a couple different things in your presentation, and I couldn't help but wonder if if in your experience there's any kind of connection or correlation between, mental health trauma and then eventual suicide ideation or death. Is that something that you know anything about?
I mean, logically, it does sound like there would be a correlation, but I could reach out to the researchers here and see if they actually took, if it was the same EMS calls with the same, data. They didn't actually define that. That's a really great question. One would believe that would go together, but I'll see if I can get that teased out for you, because that's a great question.
Great. And I had one other question. So, when you showed the chart of the causes of suicide, and we had those, the highest rate by far was with medication. Can you just remind the group, what efforts there are or what opportunities there are kind of in our region for maybe take back programs or anything like that to try to help with the rates of those things being out in the community?
Oh yeah, definitely. And that might be a perfect lead in to get Paul to reach out to Dr. Funsal at Charleston Center and get them to present on all they're doing to distribute it. So they're distributing Narcan, doing all kinds of trainings to law enforcement, any agencies, any people. They're working with the police departments across our area to do drug take back weekends and evenings. I'll get some information from them that I can share through Paul. But that would be a wonderful presentation to have. They've been working very hard. They even have a vending machine at the jail to get Narcan kits. So yeah, they're doing a whole lot, and I do think that would be a wonderful thing to share with this group and have a presentation from them. So thanks for bringing that up.
Dr. Richardson.
Thank you for that presentation, Jennifer. There's a lot of great information to share and really important, I think, for us to think about. I wanted to highlight one program that you or Maggie may want to chime in on, and that's with the Boeing Center for Children's Wellness. They have started, I'm not even exactly sure of the title, but a mental health support initiative with funding both from Boeing and from the Charleston County School District, and are trying a number of sort of innovative initiatives at various schools across the district. And I'm sure that you were working with them, but I would love to hear from, I think it's Erin Schurter, maybe is how you pronounce her last name, is sort of the contact at the Boeing Center for Children's Wellness. I sit on the Charleston County Medical Society School Health Committee, and we hear updates from all that they're doing frequently. So that might be someone that we bring along with. I want to second the idea of having Deotis come and present. Paul and I were lucky enough to get a tour of the Deotis facilities here at the New Charleston Hub. And Jennifer also gave me a tour of the Crisis Stabilization Center. And I will say it is a beautiful facility and really shows the respect that our community members deserve who are in crisis and looking for help. And likewise, many innovative programs with Deotis that Jennifer and her organization work with them on providing substance use treatment and support groups and medication assisted treatment here at the Social Services Hub. So I just wanted to sort of put in a plug for having both Deotis and the Boeing Center for Children's Wellness come to talk about sort of efforts that they have, especially the Boeing Center Children's for Wellness, when we're talking about youth mental health and all the increased needs that we have seen in recent years. Thanks for presenting.
Anyone else? Any other questions? Well, thank you again, Jennifer. Thank you so much for all of that information and all that you and your staff do. Thank you. Paul, did you have something?
Jennifer, is there anything for us here at the city that we can do to, in addition to what the police department or others are doing? Is there anything we can do to help you with mental health?
I mean, it might be good to put 988 number and mobile crisis numbers in your weekly newsletter to let people know where to call, and that there is someone that you can call if you need help. Because and then just I'd say whenever you're doing kind of community events, I know several people on this call often are there, or we're there together a lot, but just inviting us to have a table and try to share information. Mostly what I find is people just don't know what's out there, and we're not, we're pretty rich in resources compared to some areas, but still people they just don't know what still is available to them. So I think that would be a start for sure. Just make sure you invite us, and I know we all work hard to try to let people in the community know what we're all doing as a community, but we can never talk enough to make sure that people know.
Thank you.
Mr. Mayor?
Thank you, council member, and Jennifer, thank you for that, and congratulations, by the way. I was, when you first started off, that number, Charleston County, 63% of our citizens had some adverse childhood experiences. And so I guess the assumption was, there's a direct correlation, you think, between the percentage of adverse childhood experience and all this other statistics you're bringing forward about ideation and suicide rates?
Yeah, I think, over the years, I've been here a long time, and I started out working with kids. I think a lot of times, even in schools, kids' behaviors, people aren't connecting that it does have to do with trauma in their lives. So I think a lot of kids are acting out because of that, and not because, just to be a bad kid, so to speak. And I just think about when I was 28 years ago, a school mental health counselor, what we know now versus what we knew then. And the majority of it, there is trauma going on in these kids' lives. And if we could figure out how to treat that earlier, I think everyone would be better off.
Right. And you had a lot of numbers there, and I must admit I didn't catch everything. Did you have stats on veterans and active duty service personnel? Because I've certainly heard and seen where their suicide rates and attempts are higher than the average.
I don't, but I can ask as far as this data that they got from the EDs, if they were able to separate that out, and then certainly we could ask the VA.
Yeah.
I know there's data out there.
Yeah. Okay. I just didn't know if you had that for our local numbers or not, but anyway, thank you for a little sobering information there.
Yeah, I'm sorry. It's not good information, but it's good information, right?
Right. That's thank you.
Thank you again, Jennifer, and we'll move forward to our community health update, and I'll call on Dr. Katie Richardson, please.
Thank you. I don't have too much to share today, which is good with 5 minutes left. But I did want to say that April 3 through 7 is National Public Health Week. And as I see events happening, I know when USC is planning several events, and I think that we will as well. I will share those with Paul to share with this group. We continue to see COVID cases as well as hospitalizations and deaths in the community. We had over 3,100 cases. That's not including the at-home test last week in South Carolina, and 34 new deaths. So appreciate seeing the Charleston County School District continues to offer testing for COVID and flu. We also have at-home tests free of charge to pick up at any health department clinic sites, and flu and COVID vaccines are still available at local pharmacies as well as the health department and providers' offices. I was happy to see that a combined flu COVID at-home test was recently approved by the FDA, and we hope to see that available to the public in the coming months. The ACIP, which gives recommendations around vaccines, recently met, looking at the evidence for whether those at higher risk for COVID needed another vaccine over and above sort of the yearly booster. And what they found was that the booster seems to be holding steady. And even though there's some decrease in protection, there is no recommendation for a follow-up booster in between the original booster and one sort of a year from now. So the plan still at this point is recommended a yearly booster, likely in the fall, even for those who are at high risk. And then I wanted to point out a couple of events coming up. We are a fast track city to end the HIV epidemic by 2030. And on April 21st, here at the Charleston County Health Department, we will host an intra-jurisdictional Ending the Epidemics Fast Track City Alignment Workshop. We're looking forward to having the mayor as well as Paul join us for that. If anyone else is interested, please let me know. We would love to have you. And we will be talking about how to align our work with Columbia and actually the state as a whole. The entire state gets federal money around ending the epidemics because of our increased rates of HIV in both our rural areas and our more urban centers. So that's happening April 21st. And then AFA, which is the Alliance for Full Acceptance, is holding a virtual LGBTQ health education and advocacy conference on March 30th and 31st. And I will send the link to register for that to Paul. And then lastly, I had the opportunity to be on the steering committee for a legal needs assessment done statewide, and recently the report came out, and I will put that link here in the I'm not sure, I guess that's the link. I'll put it here in the chat, and if that takes you to the right place, great. If not, I will send it to Paul. But certainly social determinants of health, I think, are one of the things that Jennifer was referencing in many of the adverse child experiences, and access to legal assistance or legal aid is yet another one. And so I encourage you to take a look at that and let me know if you have any questions or would like further information. The full report is there as well as its executive summary. So I think I'll stop there and see if there are any questions. And thanks as always for having me.
Any questions? Thank you, Dr. Richardson. Appreciate that great report. And anything else to come before this committee? We're at the end of the agenda here. Anybody have anything else? Well, if not, I hope you'll have a great rest of your day and a great weekend this weekend. And thank you so much for joining us. Appreciate all the work you do in our community and for spending time with us to make our community healthier. So thank you so much. And
thanks, everybody.
We are adjourned.